Thank you. And thank you for Council letting me deliver the speech. The evidence is compelling. We need to introduce 20-mile-an-hour speed limits on our residential streets. There are still too many needless deaths and injuries on our roads. In 2019, according to police records in East Sussex, there were 934 casualties on 30 miles per hour roads at a total cost of 63 million. Using the cost calculator on the 20's Plenty website, implementing 20 limits on most 30 limit roads in East Sussex would be a one-off cost of 2.2 million. And that could have saved 149 casualties and £10.1 million per year. Reducing the speed limit to 20 in residential areas is recognised as one of the most significant moves we can make to save lives. How do we know this? The evidence comes from existing schemes reviewed by reputable sources, including the British Medical Journal. Statistics vary across the reports, but they all conclude that 20 limits reduce road deaths and injuries, and they open up streets for people to walk and cycle. In the city of Hull, for example, the killed and seriously injured was reduced by a massive 90%. And even in self-enforcing schemes, where there is only a reduction of 1 to 2 miles per hour in average speeds, casualties reduced by 5 to 6%. This is actually unsurprising. It's really simple. Faster cars take longer to stop and do more damage when they hit someone. Higher speeds mean drivers have less time to identify and to react to what's happening, and it can turn near misses into crashes. At 30, the margin for error is minimal. A quick glance away and you will miss a child running out from behind a parked car. Hitting a child at that speed is an equivalent force to he or she falling backwards and head first from a third-floor window. We say backwards and head first to demonstrate the lack of control a child has in a road crash and the potential for that child not only to be hit severely on their head and upper body, but also to be run over and crushed. If saving lives were not reason enough, there are health and environmental benefits too. Recognising these benefits, the Primary Care Trust in Liverpool have part-funded 20 limits on their streets. We know on the environmental side, air quality improves, noise pollution lessens. It does make it safer for pedestrians, cyclists and car users alike. It's popular too. Believe me, it's really hard to find anyone living in a 20 limit who wants it put back to 30. So I fail to understand why this administration is saying no, with the occasional maybe for individual roads where there's a history of high killed and seriously injured, and where the communities have to pay at least half the cost themselves. And even then, they could wait years and years and years for any changes. The lead member says East Sussex County Council cannot fund the change. I accept that funds are limited, but we've heard in the earlier Cabinet report about a surplus at the moment. I believe the administration are abdicating their responsibility by not working towards this limit. They could say yes, it's plainly a good idea and much better value for money than putting in place the odd engineered zone. Most of the biggest UK authorities have chosen wide 20 limits. So let's go and talk to them and see how they manage to fund it. Let's put in place plans so we can lobby government for funding for this specific issue. Let's explore what public health budgets might be available. Let's have schemes ready to go so that any future active travel grants could be used. The total lack of ambition I find utterly depressing. So please show some leadership and vote for the amended motion, and let's work together to make our communities safer and healthier.